Hi, and welcome to another video from the CTAD Clinic. My name is Dr. Mike Lloyd and I'm the Clinic Director. In the video today we're going to be looking at some grounding exercises for part of the dissociative disorders known as depersonalization and derealization. So while these are very different parts of the dissociative spectrum, they are quite similar to each other in terms of the way in which people can break out of the difficulties that they get into when these are sort of taking over. And what can often happen is a person gets triggered and they sort of depersonalize or they derealize, and they kind of lose contact with either themselves or with the environment or the people around them. And it can be quite a difficult process. And often people get quite stuck. When they're stuck, they might be knowing that they're within the sort of like the hold of these symptoms, but they're unable to sort of break out and just sort of generate a calm and get their thoughts back on track. And this is sort of one exercise that I can work with patients to help them really sort of like develop that getting back on track. Now, what I would recommend generally is that nobody relies on just one type of strategy. I think it's much better to have like maybe half a dozen, so 5 or 6 different strategies to use as a sort of like a process, a sort of like a sequence. So try 1, see how it goes, try 2, see how it goes, try 3, see how it goes. And what can often happen is that by the time the 4th or 5th sort of grounding exercise takes place, enough of the thinking has sort of recalibrated itself to just allow the person to sort of like get back in touch and find out exactly where they are. And that really reduces the intensity of the depersonalization and derealization symptoms. So this exercise is simply one of those. So what I would recommend people do is try and work out like a different series of grounding stations. So this is ideally done in a safe place, for example, at home, where a person might feel quite safe, where they develop these different grounding stations where they can move throughout their home, or they can just move their eyesight throughout a room. Like in here, you might go from one place to another place to another place. Each of these objects or each of these things is present within this sort of space, and you sort of develop this sequence of what I call active curiosity at each point on the grounding station to try and recalibrate the thought process. And the first example I'm going to use as the initial grounding station is using a picture or a painting. So it could be a postcard, it could be a poster, it could be an art painting, whatever it might be. And I'm going to show you an example of one that I have at home that I think would be really a useful way of being able to sort of describe exactly what I'm talking about. So the picture on the screen shows a sort of a wooded scene with a bit of mist, a bit of sunlight, and a couple of dogs running. And in the background, there's a couple of people who are obviously the owners of their dogs. So the process would be this, and this is to practice not when in depersonalization or derealization mode, or let's call it DPDR mode. So this is when these are not active symptoms. So when everything is calm and everything is fine, this is the time to practice. See it like a muscle memory type approach. So the more you practice it, the more you're actually going to sort of like smoothly transition into it as and when you need it. So this can also work for people with panic attacks or high anxiety, whatever it might be. It's a way of kind of externally using mindfulness as a tactic to bring back the thoughtfulness. So what a person could do is when they feel the depersonalization, derealization symptoms coming on, they go, okay, my DPDR is hitting in. I can feel that I'm starting to lose connection to myself, to the surroundings. I got to go to point 1 on my grounding station. So you might stand in front of this picture, and then the active curiosity steps in. So what I would do is start with a series of questions to try and develop the narrative behind the picture. So in this particular instance, what we might be looking at are things like, what are the dogs doing? Where have they been? Where are they going? What is it that they're trying to achieve? I wonder what the names of the dogs are. Are the dogs related to each other? Are they friends? Have they just met on the walk? Are the 2 people in the background? Are those old friends? Are they a couple? Are they people who have just met on the walk and their dogs have sort of bounded off into the distance? So as you can see, just looking at this, you can really kind of get into a story about what might be going on behind the scenes. And as you get really into the story and you're really trying to start developing this narrative, what happens is the DPDR starts lessening, the intensity of it starts lessening, and people start coming back to the spot where they should be, and they start realizing they're standing in front of a picture, talking to themselves either inside or outside, asking all these questions, maybe having a bit of fun with it, but being curious and suddenly realizing they're back in the space. And the DPDR sensations have really reduced to the point where a person can take a deep breath and go, right, I'm back, I'm centered, I'm back in myself. Big sigh of relief, off you go, get on with the things that you need to do. And if when doing this approach it doesn't work, or it just, things remain tangled, you go, fair enough, I've spent 5 minutes or so in front of this first grounding station, I'm still experiencing the DPDR, I'll move to the next grounding station and I'll try the next tactic and I'll see how that goes. Because even just moving from one sequence to another is about being thoughtful and about being present in the space. So here we go. So that's realistically just what it comes down to. It's a simple tactic. It's part one of what you might have as a sequence of 5 or 6 different things, and you start getting into the flow. It's always to be practiced when calm and when safe. So put the picture on the wall, stand in front of it, start developing some stories so that when the DPDR is hitting and you're standing in front of that, everything seems familiar and you might try and start generating different things. So each time you look at it, you've got to find different names for the dogs, for example, got to find different answers to the curious questions. So thanks ever so much for watching the video. It's a slightly different one. It's a real technique focused thing. So it's something to be practiced, definitely to be discussed within therapy, to start talking a therapist through. If the therapist has pictures or objects in their room, you can start developing this within the therapy room, using the therapist as your support mechanism to really try and sort of start working this process out and getting really, really good at it. And that's what it comes down to. So look forward to reading the comments. As always, please do the usual like, sharing and subscribing. Click the notifications button so that you know when a new video is dropped. And in between now and the next video, as always, please do take great care.